When the pandemic started, I was in the emergency room. So many of the community that came in that I saw really didn't trust the healthcare industry anymore. They didn't trust what vaccines we were telling them to get. Everything was put into question. These people that they had worked with, that had cared for them for 20, 30, 40 years, they just didn't believe anymore. Ready? Higher.
The pandemic changed things. People are not going to brick and mortar buildings like they used to for their healthcare. They are making decisions based off of what happened to somebody else that they posted on TikTok. You're not going to see the change in vaccine numbers unless you're out there amongst the people.
And it's not easy to set up these relationships in these rural areas because you have to build that trust. You need boots on the ground.
What'd you do for a giveaway?
So we've got some baby wipes and some butt cream and some baby shampoo. All right, you set?
Yep.
Okay. So maybe we'll have a good turnout today. Here you guys go. You're welcome.
Good morning, guys. My name is Harley. This is Ashley. We're with UT Knoxville College of Nursing, and we're a part of a project that's called the Community Nurse Navigator Project. We have 16 nurses scattered out across the entire state, just trying to do some vaccine education to new parents, expecting parents, and the older population as well. So statewide, we've seen a huge decrease in routine immunizations. So we're falling below 90% of our kids being vaccinated.
In a perfect world, I would wish that, all moms would vaccinate their kids, or at least know what whooping cough is and what that looks like. Have you seen a little infant struggling to breathe? It's sad. So, I think it's really important that, hey, if you're not going to vaccinate your child, you know what you're not vaccinating against.
So this is actually an infant girl who has whooping cough.
This is the reality of what it looks like. They are literally suffocating on themselves. There's not a way to really sugarcoat that. And, if it bothers you to look at that and see that, then that's why we have a vaccine, and that's why someone has worked so hard to get that vaccine.
Go River!
I have lived here pretty much all my life, and it's a really good place to raise your children. My name is Ashley Walton. I am a community registered nurse navigator for the Upper Cumberland region. Pickett County is very rural. We have a population of 5,000 people. The town events and stuff that are there, people tend to go to them, so you want to make sure that you're there. So we set up at the Pickett County Senior Citizens Center.
Now, he's fast with that. Yes.
One of the things that I learned really early on was that they love being competitive. So I was like, well, how can I make this competitive and fun for them? And I was like, I seen they had buzzers on Amazon. I was like, we need to try health trivia.
So out of every 100 people who get shingles, how many will get it again? Buzz. 4? Yes! And so this is why even people over 60 who've had shingles are still recommended to get the shingles vaccine. You are our champion! Good job!
We defeated the boys!
To keep us accountable and stuff like that, I have surveys for you guys.
So the surveys help us know if what we're teaching is beneficial. It's just a really helpful tool that we can look at and then use for the next time. Also, is our program being effective?
Let's see if any of these put anything. They want to know more about the COVID shot. And then health and meds for the elderly. It looks like quite a bit of them moved up a category. This one says before the ingredients and shots they knew nothing about, and then afterwards they learned a lot about. So it looks like for the most part, they've at least learned a little bit of something, which is my goal, which I'm glad that they have, and that's why we do it. I'm just so thankful for all of you, so thank you guys.
Thank you.
don't know if there is a one-size-fits-all title for a community registered nurse navigator. It's kind of what each of us has made it. Our typical day is very different from one day to the next. One day I might be here working on completing that nursing assessment over the county. Another day I might be helping pass out food boxes. We're also passing out vaccine educational material. One day I may be at the schools helping the school nurse do the health screenings because, you know, they need to review immunization records and stuff too, but they also have to do other things, helping wherever we can so that people know us. And it takes a sense of trust when you're talking about vaccines for people to listen to you. And so that's kind of what we strive for.
Okay. Next family.
My name's Elizabeth Gonsalves, and I'm a community registered nurse navigator for the Mid-Cumberland region.
I never thought I'd be like wrapping diapers and delivering a stroller. I love it though because it's helping people with like real needs that they have.
Last delivery to make. For our job, it's about increasing vaccination rates through community partnership. There's a huge Egyptian population here in Nashville. So El Mahaba is an organization that serves the Arabic-speaking community here. Like once a month, I'll go and deliver like some type of baby supplies or strollers. With that, I include information about vaccines for them just so they have it in Arabic. Vaccine hesitancy is a spectrum. So you have people who are on the super against side, and then you got people who are on the super pro side, and then you got everywhere in between. When I've worked in like the Hispanic community, they don't have any concerns about the safety of vaccines typically. It's more so like just having the access to get the vaccines.
So we're here at the Plaza Mariachi.
So Dia de la Mujer is Day of the Woman in Spanish. It was a family event. I was able to share information at my table about infancy to older adulthood.
Got some HPV information. This one's got more information about childhood vaccines. Hola, ¿cómo estás? We just have information if you have any questions. The pneumonia is typically 2 to 3 shots. It's a series.
I asked them if they had any mobile vaccinators that were going to be there, and they said no. So I said, oh, well, I've got you. I said, I've got some mobile vaccinators that I can connect you with. And so I connected them with Health Heroes, which is a wonderful mobile vaccinator unit that I work with a lot. And they came and brought the flu and COVID vaccines for anybody who needed it. And so that's like the perfect model. There you have information for people, and here you go. You can go and get your vaccine now.
Today, I am going to do my focus group with Sequatchie County Health Council. Ready. I'm Stephanie Walker. I am the Southeast Region Community Registered Nurse Navigator. So we would like to hear your honest opinions. No answer is right or wrong. It's just what you feel. All right, so this is our first question. So what do you or the people you serve think of routine immunizations? So this would be like flu, MMR, tetanus, hepatitis B, for example.
The flu shot makes you sick.
Flu shot makes you sick, okay. Do they typically get their vaccines?
Coming from an education background of working with kids, you know, it was always required. I retired in 2008, but when a 7th grader came to the high school, they had to have had all their immunizations met. There were a few opted out, but it had to be written out and put in their files. That may have changed since then.
That was me.
She was one of the ones.
We take all this information, compile it at the end. We're able to present it as these are the barriers that were found in these areas. And we say, okay, these are some of the things that we think we can do. If it's transportation, maybe working with CETHRA. If it's the vaccine hurts, there's other things that we can do for that. They make stuff now that'll kind of numb that area. And so that's some stuff that we can suggest to providers. What about being too healthy to need vaccines? Do you think people think that in this community?
I think some people are a little bit afraid of the COVID shot, just from what I've heard from family members and others.
I think there's a lot of disinformation floating around on the deep web.
Yeah. So social media plays a big part?
Huge.
The biggest part.
So I asked them all to take a survey at that meeting, asking people their opinions about the vaccines. Some people just go through and mark all ones if they don't really want to read them, but some of them looks like they read them. Vaccines can cause long-term health issues. They strongly agree with that one. So this one's kind of in the middle. See, this one also says vaccines can cause long-term health issues. They strongly agree. Vaccines can cause certain disorders. Strongly agree. Education has been a big barrier. Misinformation. When I've done interviews with people, I try to ask them, please explain. Why do you feel this way? Where did you find this information? I mean, everybody wants to be listened to. So I think that's what it is a lot of times. Nobody has listened to them, and they want somebody to hear them. We can have different opinions, but at the end of the day, if they'll listen and just see what I have to say, and I'll listen to them, see what they have to say, and maybe we'll come to agreement on something.
COVID changed a lot of people's views. Whatever they view COVID as, unfortunately, that became the view of other childhood vaccines.
I definitely saw a shift in between when I was caring for patients in the hospital and then around 2022. It was mistrust and suspicion around how quickly the vaccine came out and why everybody had to get it. I feel like it's still pretty 50-50 when you bring up the subject of vaccines.
Unless you understand what their concern is based on, you can't help that. Vaccines, if you've not had the right information, can sound like a scary thing. There is a lot of misinformation out there. And if you were just to look at some of the ingredients in some of these vaccines and didn't really know the research behind it or how that compares to something that's in our everyday environment, it might seem really scary. And if you're a parent, you want to make the best decision for your child. And if you think it's going to do more harm than good, then you're not going to get it done. I've had parents tell me that their child will never receive another vaccine as long as they live in their household as a result of COVID. We've went from one extreme to another in some cases. And I think that's scary because it's scary for what our future might hold.
Mama, I love you.
I cannot imagine a world where my girls grow up and see someone with polio.
I'm going to jump on a trampoline.
Okay, go on.
I care about the people that are in this community, and I would hate to see them not be there anymore because of something that we could have prevented with vaccines.
Good job. They're giving you a run for your money today, aren't they?
You become a nurse because you genuinely love people and want to help them.
Nurses were really able to fit in with whatever the community needs. Sometimes that looks like going and delivering strollers. Sometimes it looks like going and doing like a bingo with some seniors.
It's not just vaccines, it's other things. We're in the communities, we're showing up, and I think that means a lot to people. If you show up and you do what you say you're going to do, it means something.
The Nurse Navigator project, it's laying the groundwork for people to trust healthcare more and healthcare workers. I don't think that this is a short-term fix. That trust isn't fixed in a day, it's not fixed in a year, it's continually showing up.